Hi, and welcome to another vlog on my recovery from TLIF surgery, which was on the 30th of May 2023, and today is the 13th of June 2023. So today I want to talk a little bit about milestones and also just give you an update on how I'm feeling. So milestone-wise, it is now exactly 14 days since I had the surgery, and that has absolutely flown by. Since my last update, I've managed to clock 10,000 steps per day for the last 3 days in a row. Of course, that's not all in one go. I mean, I tend to do three walks per day and kind of spread out the load a little bit. But the longest walk I've done so far has been about 2.2 kilometers, which I think is pretty good going given only 2 weeks have passed since the surgery. I also saw the surgeon yesterday, primarily to remove the staples that were still around the wound. He had a look at the wound. He's very happy with the progress, and it does seem to have healed and closed up quite nicely. So I'll be seeing him again in about 6 weeks' time at the 8-week mark, which will include taking x-rays and just making sure that the spacer and the pedicle screws, etc., are all still in place. Just a general update on the recovery. I also saw the physiotherapist who helped me in hospital. Pleased to say that she gave me a few more exercises, so I'm now able to do bodyweight squats, bodyweight lunges, calf raises, and I'm also allowed to start exercising on a stationary exercise bike, as long as two conditions hold. The first being that it's not high intensity, and secondly that also just listen to my body, and if the back starts to hurt, take a step back. I no longer have to wear the compression socks, which is also very exciting because it's been quite a wrestle to get those bad boys on every night before going to bed. I've also been cleared to drive, which in and of itself is quite a nice sense of freedom, although I haven't actually driven as yet. I'm sure the opportunity will come over the weekend. I took my last opioid drugs about 2 days ago as well. So the rest of my drugs I probably have between 3 and 5 days left. So on the one hand, quite liberating, not to be taking drugs anymore at that point, but also a little bit scary, just because I don't as yet know what the pain's going to be like at that point. Today also marked my first day back at work. So when I say back at work, I actually ended up working from home, just because not sure my back is quite ready yet for driving into the office, sitting in traffic for 45 minutes, then sitting in meetings for kind of 6 to 8 hours a day. I did mention to you before that even though walking, standing and sitting are all comfortable, they become uncomfortable after about the kind of 20 to 30 minute mark, and then I have to start getting up and moving around or changing position and so on. But I'm fairly confident that by the time we get to next Monday, I'll be able to quite comfortably drive to work and spend a day in the office. So how am I feeling? So you may have sensed in my last update maybe a little bit of a sense of frustration in terms of how the recovery had slowed down. But I'm pleased to report that pretty much the very next day I kind of noticed a step change again in terms of the recovery, which was kind of what enabled me to then pick up the number of steps I did from 5,000-6,000 a day up to 10,000 a day. The pain is honestly fairly limited, so I'm fairly comfortable that if push came to shove, I probably could go a day without painkillers. But for the time being, I'm just trying to stay on top of the pain and get through the drugs I've been prescribed. But from next week onwards, as I mentioned, I'll be on my own, so I have to assess how that's going, and obviously keep some paracetamol and ibuprofen to hand just in case things flare up after I run out of the prescribed drugs. I still have the numbness on the outside of my foot that I mentioned before, although it has improved. And it seems to have improved as a result of me starting to massage my left glute a bit more. So I've got one of those spiky massage balls that I kind of sit and lie on and use to kind of massage the glute out, as well as a massage gun, which my wife helps me to massage the glute with, because there's a small little muscle called the piriformis, which can basically squeeze the sciatic nerve between itself and one of the bones in the kind of buttock area, which is actually called the piriformis syndrome. So since I've been doing that, it definitely has helped. But as I mentioned before, it's going to be a question of being patient to get through the next month or so and just allow the nerve to heal after it was compressed for as long as it was. The range of motion in my back has also improved a fair bit, which is quite nice on the one hand, but a bit dangerous on the other. Why I say dangerous is because it can lead you to forget sometimes that you actually had the op in the first place, and you move your back in a certain way that obviously doesn't agree with. So needs to be a bit more careful, but as I explained previously, I am wearing the brace, which does give me a certain element of support there. So yeah, generally, as you can hear, it's been a very positive last 3 or 4 days. So my state of mind has been improved a fair bit based on all the doctor's visits and so on, and just being able to compare my progress against others. Now on that point, I did see all the other patients that had the surgery on the same day with the same doctor in his surgery on Monday, and I'm pleased to report that I seem to be progressing equally as well, if not slightly better than the other patients. But it's all very personal in so much as how fit you are, how old you are, etc., going into the operation. But just it's important to note that it's probably going to be different for each person, the journey of recovery. Okay, so that's all for today. I'm going to start spreading the updates out to at least once a week from now on, just to make sure that I've got enough to share with you. But as you can hear, so far so good, and I look forward to sharing some more with you on day 21. Thanks.